I'm calling to order the Joint Subcommittee on Human Services. Welcome everyone to in attendance here in Carson City, those of you that might be watching online and those of you that are in Las Vegas. Committee Secretary, can you please call the roll?
Assemblymember Brown May. Here. Assemblymember Dickman. Here. Assemblymember Hafen. Assemblymember Hibbets. Here. Assemblymember Howdegi. Here. Assemblymember Monroe Marino. Assemblymember Yeager. Here. Senator Canizaro. Senator Dondero Loop. Here. Senator Stone. Here. Senator Titus. Here. Assemblymember Mosca. Here. Chair Wen.
Here. If we can mark Assemblymember Monroe Moreno absent excused, and the other members as they are entering, including Assemblymember Hafen, present when they arrive, that would be greatly appreciated. Good morning, everyone, again. I know I've said that before, but we are here to hear 7, Division of Public and Behavioral Health. This is always a mouthful for me, the DPBH. I don't know if I will ever get used to saying those letters all together, but I'm very excited. If you guys, we have the 7, they're on the full agenda for the full list of the budgets that will be presented today. If I can remind speakers when they come up to the table to please state your name and spell it first and last for the record on the very first time. And every time you are asked to speak again, please repeat your name for our committee staff. I know it'll be super helpful for them, and I know I am still trying to get better and improving on my ability to remind people to say their names. So with that, we will go ahead and call Cody Finney up to the administrator of DPBH to present her budgets. So please begin when you are ready. And if you want to go through your budgets, and then we can stop in between them and have any questions that committee might have.
Thank you so much, Chair Wynn. Good morning, and members of the committee. Thank you for the opportunity this morning to present. My name is Cody Finney, and I serve as the administrator of the Division of Public and Behavioral Health. And I'm joined today by Deputy Administrator Andrea Rivers, who's our Fiscal Services deputies. And we brought a whole amazing team of our subject matter experts in case you have detailed questions about the programs. All right. The first several slides here, 2 and 3, do go over our mission and vision and values again. We put those in for your review. You've heard me speak to them before. We did spend a lot of time in this interim working on improving those for our accreditation efforts, and we're very proud of the work we did there. On slide 4, we've highlighted our operational units. Today, we're going to be mostly focused on community public health services and regulatory and planning services and the administrative support services. Slide 5 is a repeat of our current organizational chart. That does not reflect any changes that are proposed in these budgets. On slide 6, we have an illustration of the total budget by funding source for all of DPBH. You can see there's a modest 2% increase there. I do want to say that other includes fees, transfers, billing, and non-federal grants, including some of the ARPA monies that came to us through other sources, not directly from the federal government. Slide 7 illustrates the funding breakdown by general fund, federal, and other, as I just described, for only the public health budgets. So that gives the contrast. This does illustrate a very small, less than 0.5% decrease in funding, and that is primarily due to the ARPA money that will be diminishing over this biennium. All right, slide 8 is a table of those public health budget funding source breakouts for those of you who prefer to learn that from a table format. I myself prefer the pie charts. All right, that's the general overview. From here, I'm going to go into the specific budgets listed in the agenda. And we'll start with 3223, which is our administrative budget. And this budget does provide services to the division as a whole, not just the public health side. All right, on slide 10, we start with the enhancement units. E253 is our decision unit regarding security software solutions. This is primarily funded by a federal contract and reserves. And that does make sure that we're keeping up to date with security standards for all of our data analysis, data transfer, and document processing systems in the division. E499 and 599 are a request to continue 8 intermittent positions that were established when ARPA was established. The division designed these positions to assist with some severely needed fiscal support. A review of workload over the past interim did show a need to continue these positions. So there were 13 positions originally, and the remainder, the ones that we are not requesting to continue, those were specifically focused on ARPA projects, that workload will go away. These 8 positions, the workload that they're focused on will continue. And that funding source is primarily cost allocation and reserves. All right, the next one is E505, 510, and 517. This represents a one-time general fund infusion to offset the loss of indirect funding related to the 3 budget accounts that we'll be transferring in support of the newly established Nevada Health Authority. That indirect rate is calculated every year, but based on data from 2 years previous. So we'll need this one-time plug of general fund to hold 3223 harmless while we make this transition. And then by the next biennium, that calculation of the indirect funding will have caught up with where we are with those grants and other sources, so that we won't need that to continue. I know I had a really excellent point here I wanted to help share with you. Please forgive me, a little nervous this morning. So we anticipate that this is, like I said, a one-time fund. It's cost allocations, reserves, and some 82% general fund on that particular item. All right, and finally for this budget, we have E906. We're supporting the creation of the newly formed Nevada Health Authority. These are the administrative positions that would transfer into the new department. There's a deputy administrator, an administrative services officer, and an accounting assistant that would go with that work that we will send over to the new department. All right, that is 3223, the Office of Health Administration. Are any questions on that budget account?
We do have some questions. I think we will start with Senator Dondero Loop.
If I can find the button. Thank you. I'm down here in timeout, but I have a question anyway. So you're talking about needing to retain the 8 positions that are currently funded with the ARPA funds. And so can you talk about the need for that a little bit? And then I have a follow-up, Chair, if you don't mind.
Go ahead.
Good morning. For the record, Andrea Rivers, R-I-V-E-R-S. I serve as the Deputy Administrator for the division. Madam Chair, through you to Don Loop.
Please feel free to go directly to the member.
Thank you. We have done analysis on the workload, and that was based on state fiscal year 23 workload. Our division processed over 500 contracts and nearly 500 subawards during that period. That does not reflect the MOUs, data use agreements, and other documents that we process through budget 3223 in our administration office. And so we have about 68 staff with these ARPA positions. That will go down to about 58 staff. We do not anticipate that workload to decrease at this time. As of January 31st, we've already processed approximately 400 subawards, and we have 300 contracts that we're monitoring and tracking. Again, not including the other documents that we do process for the division. So upon that analysis and the workload that was done in state fiscal year 23 and what we already know we've seen in state fiscal year 25, we anticipate that workload to continue.
So, how many are actually vacant right now?
For the record, Andrea Rivers, currently 10 of the positions are vacant. Of the 10 that we brought on, well, there's 13, excuse me, but 10 are currently vacant, and that is due to these are intermittent state positions. So these were long-term state employees who took these positions, and they didn't want to get into a position come June 30th where they could be laid off. So they did start looking for other opportunities. So as of January of 2025, unfortunately, those positions are vacant at this time. We were able to retain a few of them in DPBH and other roles. We did lose a lot of them to other agencies within the state, and along with that, their knowledge and expertise in those positions for a few years.
And then, I'm sorry, Chair, can I continue to follow up for just a minute? So who is doing those jobs? So is everybody just sort of pinch hitting here?
For the record, Andrea Rivers, correct. We do have staff who are working overtime in our accounting units, our contracts units. We are definitely, as you said, pinch hitting at this time.
Thank you very much. And one of the reasons I ask, and I haven't followed up on this, but I had noticed I had a bill last session, Senate Bill 286 on multiple sclerosis, and I know part of that bill was putting info about that on the website, and I don't think that was completed. And so I know that you're on overload, but that is one of the things that I was thinking when you've got lots of people doing other jobs that they aren't assigned to. So, all right. Thank you very much, and thank you, Madam Chair.
Thank you. Do we have any further questions from the committee? Seeing none, I think we will close the budget hearing on 3223, the Office of Health Administration. And I don't know, Administrator Finney, if it is still you presenting all the budgets. Yep, you're going to be there the whole morning. But we will open up and any presentation that you have on 3194, the Environmental Health Services budget. Go ahead and begin when you're ready.
Thank you, Chair Wynn, Cody Finney, for the record. We will, slide 12 is an overview of the Environmental Health Services budget. This program provides inspections to prevent transmissible infections, things like they inspect food manufacturers, restaurants, pools, and tattoo and invasive body design establishments. So on slide 13, the enhancement request related to this budget is that in our efforts to streamline between agencies with similar food oversight responsibilities, we are proposing to transfer 12 of the 15 staff to the Department of Agriculture, where they have some other types of food inspection and food processing inspection responsibilities, and they will consolidate all of those food-related inspections, and that's E905. I will point out that the budget narrative says we're transferring 15 positions to agriculture. It should be 12, and we have submitted a correction for that. And my friends at Agriculture, who are generously here today to answer any questions you may have about their role in this, are aware of that. Then we move on to E910, And that is the transfer of the remaining 3 positions to the Bureau of Healthcare Quality and Compliance. That entire bureau is proposed to move to the Nevada Health Authority, and those 3 positions would continue to manage those non-food programs, including the tattoos, septic tanks, and public swimming pools. I also want to point out that we are including in this a transfer of significant reserves to agriculture. We are aware we had done a fee analysis in this program and determined that the fees the program is currently charging are not adequate to support the program. So we're transferring those reserves to make sure that agriculture has enough funding to continue on while they make arrangements and evaluate whether they need to go ahead with those fee increases. Any questions regarding this budget?
We do have a couple of questions. I think we'll start with Assemblymember Howdeggy.
Thank you, Madam Chair, and thank you for being here and for the presentation. And I have questions regarding the how it's being split into 2, the fund. And so it's my understanding right now that that you're funded with federal grants, licensing and permit fees, and county reimbursement. So there's a few different areas that fund the program, and you need to be able to track revenues and expenses for reporting purposes because there are statutory requirements that you must follow. And so can you just kind of walk us through how you will separately track within the dairy fund and healthcare facilities budgets to remain in compliance?
Cody Finney for the record. Yes, those costs would be allocated based on the staff and the time spent. We do a lot of collecting how much time is spent and tracked by the 2 agencies. I will invite, if agriculture wants to add to that how they intend to do that, I'd invite them to join me.
And with that, if you could add to, if they want to address that, how you will make sure you're going to avoid any commingling of existing funds within those budget accounts.
Cody Finney for the record. I would certainly have our administrative staff make sure they're addressing all of those issues and track those issues. Please.
For the record, Kathy Balcon, B-A-L-C-O-N, Administrator of Administrative Services at Department of Agriculture. So as Administrator Finney had said with the tracking and how they currently track, can you repeat that first part one more time?
Yes, and so my question was, I know that there's statutory requirements you have to meet and you have to be able to track how the money is spent. So can you just talk to us about how you're going to track the revenues and expenses for each program and how you're going to separately track them to ensure compliance with statutory requirements that the funds only be spent for specific expenses?
Yes. So for the record, Kathy Balcon, we currently have different revenue GL set up. So each of those different monies would go into those different accounts, and we'd have this budget account, the dairy we would add a couple more RGLs to that to be able to track the different programs that are coming over. So with the meat inspection, so we'd have a different RGL for a meat inspection, and then our different environmental specialist roles.
Okay, and then one more question, if I could, Madam Chair.
And could you clarify what RGIs are?
RGL, it's a
RGL.
revenue general ledger.
Thank you.
Follow up?
Go ahead.
Okay, thank you. And I know you guys had mentioned you'll be transferring reserves to ensure there's enough money in the accounts, but can you talk to us about what steps are going to be taken to revise your fee structure in order to ensure that there's going to be sufficient revenues being collected in order to maintain the program in the future?
So yes, we are currently, Kathy Balcon for the record, we are currently working on with the Department of Health and Human Services on the fee structure of what they were going, as the Administrator Finney had said before, they had looked into raising these fees as they have not been raised in quite some time. So we are currently working with them and doing analysis analysis to see where we need to be on how much we are going to raise to make sure that that budget account is solvent.
For the record, Andrea Rivers, just to add to Ms. Balkin's answer on the fees, we have worked with a third-party CPA accounting unit, or firm, excuse me, over the past couple years to look at our fee schedules and fee analysis. And particularly in budget account 3194, we did identify that we would be in a deficit of approximately 226,000 in state fiscal year 26 in fees. So we have been working through that analysis process, and we will be working closely with agriculture with the transfer to ensure that it's not perceived that this transfer was the catalyst of a fee increase. We have been working on that within DPBH for some time.
Thank you. Thank you for that question. I read that answer. I share some of the concerns that Assemblymember Howdigi brought up. This isn't the first time that we brought up the need to increase these fees. And it was brought up at least in 21 and again in 23. It's clearly that this is an insolvent thing. We've done the fee analysis, it looks like several times, that always comes to the same conclusion. And I think in your presentation, you said we need to increase these fees in order to become solvent in this account. Obviously it is not a part of the governor's recommended budget to increase those fees. Will we be able to maintain this without those fee increases past the 2027, fiscal year?
Cody Finney, for the record. The purpose of the reserve transfer is to make sure that for the next biennium it is solvent. We, again, are committed to working with our partners at AG to make sure they can become solvent. We've been successful in regionalizing more and more of these public health functions, and this program is specifically focused on those areas that don't have their own health district or a delegated authority operating local services in this way. And so one of the side effects of being successful in that regionalization is that this issue becomes more and more critical.
Thank you. Do we have any further questions regarding this budget? Seeing none, thank you for your presentation on that, and we will close that budget and move on to our next one, which is 3219. Yep, 3219, the health investigations budget. So go ahead and begin when you're ready.
Thank you. Cody Finney, for the record. Health Investigations and Epidemiology is the title in the budget books. We like to call it Office of State Epidemiology. This is one of the 10 foundational public health services that a public health department needs to provide, disease investigation and prevention of infectious diseases. On slide 15, you'll see our enhancement request. E250 is requesting the addition of one full-time medical epidemiologist. This is currently funded through a contract and would continue to be funded from a transfer from the Fund for Healthy Nevada. This epidemiologist is working on the intersection between the opioid crisis and sexually transmitted diseases, and how those two things are coming together to make matters worse. All right, and preventing that. E251 is a request for a health program specialist to support a federal grant that focuses on infectious diseases. This program, or this particular position, works very closely with the state immunization program and the local health departments. Currently, it's a contract, and it's 100% funded by the federal grant. And finally, for this budget, E499 is the continuation, the authority to continue with the remaining ARPA funds. Our project to develop epidemiologists and biostatisticians for Nevada. As of this month, we have scholarships provided to 12 degree-seeking students, and 3 certificate students are enrolled at UNR, and 3 fellowship participants are enrolled at UNLV. And we expect there more of those starting in March. That is 100% ARPA funded, and when those funds expire, that program would sunset. Any questions about the Office of State Epi budget?
We do have a couple of questions. Let's start with Speaker Yeager.
Thank you so much, Madam Chair. I have a few questions on E250 in particular. And the first one is, could you talk about how the proposed collaborative effort will be different from the statewide overdose task force that was created in 2022?
Thank you, Speaker Yeager. To you, through the chair.
You can go directly.
Thank you. The task force would certainly be informed by the efforts that this position can put into the real study of the syndemic issues here, not syndromic. I have to keep reminding myself. And so this is a single position to really work on that scientific study and provide information to the task force. The epidemiologists are here today if you have specific scientific questions. I'm not going to try to dive into that.
I don't know if I can do science or if that's wise on a Wednesday morning, but I appreciate the offer. And Chair, could I ask a follow-up question, please?
Of course, go ahead.
So my question there, and maybe this is a hard one to answer, but as that work progresses, do we anticipate that a new program might be established or that additional future positions or funding might be required based on the recommendations made by the proposed collaborative group?
Cody Finney, for the record, I'm not aware that currently that is the issue. Certainly, I would expect to see recommendations come out of those groups that could result in those kinds of recommendations. Certainly, providing the analysis and scientific study can only help us have the existing programs work more efficiently together.
And then one more, if I could, Chair. I want to ask a little bit about the source of the funding and the opioid monies. And, you know, I think I haven't been shy in saying that I think we do have a sacred duty as a state to make sure we're using that funding for its intended purpose. And, you know, I think that's even more important. I had a chance to read an article published by the Nevada Independent on February 18th by Gabby Birnbaum. And I don't know if you've had a chance to see that, but it talks about the National Institutes of Health cutting funding. And so there's some really good research being done over there, particularly by Carla Wagner, about overdoses. And the article indicates that Nevada is one of 5 states in the nation where the drug overdose rate actually rose between 2023 and 2024. So I have concerns about this, but we can't control what NIH does, but I think we certainly can control what we do on the state level with the opioid funds. So my question there really is, can you talk about how the recommendations for the funding of this position align with the requirements for how we are supposed to use the opioid funding within the statewide needs assessment and plan? And I know you said there's an intersection here of 2 issues, but I just want to get a little bit more on the record so that I can feel comfortable that this is an appropriate use of those opioid funds.
Thank you, Speaker Yeager. Cody Finney, for the record. One of the things that's feels challenging to me in the time I've been doing this work is the focus on a particular substance related to substance abuse. In my experience, people who have substance abuse problems don't always stay with one substance. And so one issue is when we're just trying to focus on opioids, there's a lot of other factors. The other part is people who are using substances often, and I'm thinking of my own family members here, so forgive me, often make poor choices, and that can result in the spread of infections that can impact the rest of the community. And so that's the intersection that this particular position is focusing on. Yes, to your the tragic increase in overdose is definitely an issue that we have to address. And this synergy with this one position and the other factors do help us look at how we can address all of those kinds of problematic issues that come together and really, frankly, destroy lives. I can certainly provide those specific justifications that we've written in the past that I can't quite recite this morning, if that's helpful.
No, thank you. And if I could make a quick comment, Chair, I appreciate that. It is a multi-factored issue, and I think every single one of us up here has a personal experience, or we know someone who's been impacted by this. So, I'm satisfied because this is a new position. What I was really worried about when I look at some of the budget is, are we trying to sort of backfill money or positions with opioid funds when there's not a nexus? This does seem to me that there is, and so my only request as this gets launched, I'm assuming we approve this and it's in the budget, if we could just remember to try to keep that focus as much as we can. Obviously, there are a whole host of issues that come with substance use disorder, and it's not as simple as maybe we would like it to be. So just appreciate the work that you're doing here and trying to get Nevada's overdose death rate down. I would really love to be in a situation where we're not one of the states that has an increase, and instead we're a state that is moving in the right direction. So thank you for the time, Madam Chair.
Just kind of piggybacking off of what the speaker had indicated, and obviously we've spent the past 2 weeks talking about the elimination of positions and programs that are related to ARPA-funded dollars. And unlike some of the other settlement programs that we have, like the tobacco settlement, that are ongoing, this has an end date on the amount of money. And I recognize and I appreciate the speaker's questions regarding the nexus between the use of these opioid settlement dollars and addressing some of the, I think it's 7 factors that have to be considered in figuring that out. What kind of assessment are you doing on the back end to see whether or not these are programs that will be needed to be carried forward once these settlement funds run out?
Cody Finney, for the record. My understanding of the settlement dollars is that's a 20-year settlement. And I think I'm very hopeful that in 20 years we'll at least have moved on to a new substance besides opioids. But we will be assessing whether, well, for one thing, whether we're seeing a decrease in those overdose deaths, whether we're seeing a decrease in the infection rates in folks that are receiving those kinds of treatments and have a history and nexus with those kinds of rates. So those assessments will be done. We're really just getting started with that. But we will be continuing to analyze that.
So is it anticipated that and we've heard in various budgets, programs that are seeking to utilize these opioid settlement funds. And believe me, I wish that in 20 years we have solved this problem. But I'm also very realistic that I don't want to be in a situation, and I don't want to tie the hands of a future legislature that is like, we funded all these positions and programs and now the money has run out and we have to find a way to do those programs, and we don't have accurate assessments on whether or not they were working, I guess. So do each one of these programs have individual accountability metrics that you are looking, or are we just looking at an article from the Independent to see whether or not we've gone up or down?
Cody Finney, for the record. The division has multiple dashboards that provide data on some of the factors similar to what I mentioned, and we use that data to make decisions about whether things are working or not.
Thank you. I think it would be helpful for everyone sitting in this dais that when you are looking at that, we can see the specific connection between those results and the programming that you've actually put in place. And I recognize that sometimes it's a combination of programming that has led to hopefully, positive results. But thank you for that. Do we have any other questions on the committee? Seeing none, thank you for your presentation on that budget, and that will bring us to the maternal, child, and adolescent health services budget, 3222, and go ahead and begin when you're ready.
Cody Finney for the record. Thank you. The maternal, child, and adolescent health is another of the 10 foundational public health programs. On slide 17, you can see the enhancement requests. The first one is to add a health program specialist that is 100% funded by a federal grant. This grant focuses specifically on maternal, child, and adolescent health and is currently operating as a contractual position. The second request, it would allow the development of the beginning infrastructure of a perinatal quality collaborative, also known as a PQC in Nevada. This health program specialist position would serve as the coordinator for that collaborative and establish the data quality measures that are needed, support the members of the quality collaborative, and organize meetings and deliverables for that group. Other states have had success with this umbrella organization to pull together the data, information, and recommendations surrounding birth outcomes, which we'd very much like to see improved. E270 reflects an increase in the federal funds for the pre-postnatal project, the Preventing Maternal Deaths project, and the Nevada Sexual Avoidance Education Grant. These grants awards currently have been raised, and that is 100% funded by the grants. Next, we have E933 and E533, and this reflects moving one position that's from the Office of Analytics to this home budget account, 3222 Maternal Child Health. The work that's being done by this individual has been determined to be more programmatic in nature and not the kind of analysis of data that is typically done by the Office of Analytics. And so we're proposing to move that back to this home budget account. Any questions regarding this budget?
We do have a couple questions. I'll start with Assemblymember Brown-May.
Thank you, Chair. Thank you, Administrator Finney. It's great to see you and your team here this morning, all of you. I do have a question. The Chair and I have the honor of sitting on the Maternal and Child Health Advisory Board, so we've spent a little bit of time walking through these issues. This PQC, I'm wondering if you could walk us through a little bit more. It seems like almost a duplicative infrastructure because we do currently have the Maternal Child Health Advisory Board, right, working on these issues, and I believe that there is a nonprofit in Southern Nevada that I know is focused on addressing moms, expectant moms who are also experiencing addiction, right? And so how are we not duplicating efforts? And yeah, talk that through, please.
Cody Finney for the record. We have the state's foremost expert on this issue with us today, Vicki Ives. She does amazing work on this this front, and we're going to let her explain that. Thank you.
Thank you for the kind words. Vicki Ives for the record, VICKIE IVES with the Division of Public and Behavioral Health. Thank you for the question and the opportunity to speak to the Perinatal Quality Collaborative. Maybe last things first, the program that you highlight is the Empowered program, I believe, which has a focus on serving those who use substances in pregnancy, through pregnancy, and the first year postpartum, with some real direct wraparound services for that population. The Perinatal Quality Collaborative has a clinical core, so subject matter experts from both the maternal and the neonatal side. So usually a neonatologist or a pediatrician functions as the clinical lead for some of the quality improvement efforts for that population. And then a maternal fetal medicine specialist or an OBGYN clinical lead. as well as some lived experience voices, community-based organizations, hospitals, hospital associations, all come together in a perinatal quality collaborative to really scale and spread evidence-based quality improvement practices. So it's more clinical in focus, I would say, than the Maternal Child Health Advisory Board, and really focused on quality improvement outcomes that can be shown. For example, in Illinois, the Perinatal Quality Collaborative, over the space of 5 or 6 years, just implementing certain hypertension patient safety bundles for preventing maternal mortality and severe maternal morbidity, was able to make significant improvements statewide on the burden of that particular disorder. So they cycle through different programs of focus to move the needle on outcomes for those two main populations. Our hope would be, if this was granted, to be able to wrap in existing efforts such as the Alliance for Innovation on Maternal Health, which is currently really an unfunded patient safety bundle program that only some of the hospitals participate in currently, that's focused on maternal mortality reduction and severe maternal morbidity reduction, could be brought under a perinatal quality collaborative, as well as potentially some efforts with our behavioral health and wellness bureau, the perinatal health initiative, that has a specific substance-related focus, both during pregnancy and then the impacts to the child once born. So I hope that helps at different lanes and really trying to have an umbrella with the clinical expertise and clinical buy-in. Frankly, that's a little different when it's led by clinical leads as opposed to with the state expertise leading the efforts, that it's really the clinical subject matter experts. I hope that helps.
Thank you. I appreciate that. If I just may have a comment, Chair. Thank you. Thank you for the clarification relative to that and the more clinical focus rather than the board. So that I completely understand. I feel like as I read this, the backup material, that the Empowered program that you mentioned does have a clinical perspective, and that's where they're coming from, specific to opioid or substance use disorder, and those expectant moms, and then that year after birth. I think that's where my confusion was, that it looks as though we're proposing to focus on substance use disorder during pregnancy for the perinatal quality collaborative program, but it looked like, as you just presented, is going to be broader than that. And so I would just have questions relative to, as the speaker noted, our overdose numbers are continuing to climb. If we have an opportunity to address substance use disorder during pregnancy, then really we avert that problem for that next generation. Thank you, Chair.
Thank you. If we could go to Assemblymember Mosca.
Thank you, Chair, and thank you for that explanation. And so do you know who already your vendor's going to be, who's doing the work on this?
Vicki Ives, for the record, thank you for the question. No, we would do a request for proposal process on that. Other states have found hospital associations, schools of medicine can make good homes for the perinatal quality collaborative and have some of those built-in clinical relationships, hospital system, federally qualified health center relationships already in place. But it would be a request for proposal process on that. Thank you.
So just to be clear, this wouldn't be something that would be done within the agency and within the state. You would anticipate that you would contract this out with an outside vendor to administer and run this like collaborative program.
Thank you, Vicki Ives, for the record. Yes, other than having the health program specialist one position that's part of the request to oversee the vendor, look at the fiscal spending, look at the deliverables, potentially help support in logistics around the committee. So there'd be a touch point with the state with that one staff member, and then the vendor would be the pass through. Also, one of the software systems, a quality improvement software system being utilized, already lives within the state expenditures currently, so we just leverage that.
Thank you. And Speaker Yeager. Like deja vu.
Thank you, Chair. I think you probably know what I'm going to ask about this one. It's, the concern is not the proposal. I think it's a wonderful proposal, and it's something that some of our members have worked on over the years as well. So that's not the question, but the question is the source of funding, particularly coming from the opioid settlement fund. So you touched on it a little bit, but I guess just so we have a little bit of a clean record and so I can be a little bit more satisfied, can you just talk about how the use of opioid settlement funds were determined to be an appropriate funding source for this proposed program?
Thank you, Vicki Ives, for the record. The example highlighted with the efforts that have been, ongoing for many years with the perinatal health initiative comes to mind specifically. There are just some efficiencies with a collaborative that's looking at touch points and opportunities across multiple types of partners that will be held. So in all the PQCs that I have had the pleasure of talking to, a substance component, certain substance-specific patient safety bundles with that perinatal time period are commonplace. They're needed. Also on the neonatal side, promoting eat, sleep, console methods in the hospital for substance-exposed infants is a common bundle as well with the perinatal quality collaboratives. The whole purpose is that they're agile. So will they address topics above and beyond substance in addition? Yes, but that's such a core issue and has such a big impact on our perinatal populations that this would be seen as a good home to consolidate some of those efforts.
Cody Finney for the record. I would add to what Vicki's saying that, as we can intervene and get these efforts out into the community, it's a prevention effort. It's a prevention effort because we get a baby off to a good start, they're going to be less likely to have a substance issue in the future. So it's not a perfect intersection maybe, but it's so critical that we get these babies off to healthy starts.
Yeah, thank you. And if I could, Chair, I appreciate that response, and I do note that one of the goals of the statewide plan, goal number 2, is to prevent the misuse of opioids. I think that can sometimes be a hard thing to quantify, right? If someone's using opioids and you're able to get them off of opioids, that's a very obvious prevent the misuse. But in terms of being proactive and making sure nobody starts is a little bit harder. So my request would just be, as we move forward, if we approve this item, that at some point in the future we just get some kind of an update, and particularly if you could talk about what the outcomes you think has been with respect to opioid abuse, but also the greater substance abuse question and other substances. I think that would just help the committee going forward to determine whether this is a continued good use of the opioid funding. So I look forward to the work. I think it's a great program, and obviously respect and support what you're trying to do. Thank you, Chair.
Thank you. Do we have any other questions regarding this budget? Seeing none, thank you for your presentation on that. Thank you, Ms. Ives. We will move on to our next budget, which is 3234, Public Health Improvements. Go ahead and begin when you're ready.
Thank you so much, Cody Finney for the record. Excuse me. Our Public Health Improvement and Infrastructure budget was established last session by this body. It's been instrumental in our efforts at accreditation and workforce development. It's coordinating our data modernization efforts and doing quality improvement for the entire division. They've recently worked on a Kaizen event to streamline our processes in our fiscal services and make sure we're as efficient as possible there. They have supported our human resources team in hiring events. The data modernization includes a data lake project, and they're teaching me about data lakes, and support of the Nevada State Public Health Lab's data modernization, which was incredibly critical. We want to thank the legislature for Senate Bill 118 from last session, and that invested $15 million in our local public health infrastructure. These funds were provided to each county or health district on a per capita basis, and we're extremely grateful to the governor for continuing that forward movement and recommending that in this year's budget. Okay, public health improvements and infrastructure enhancement request E449 allows the continuation of the workforce development efforts that we've started with this program. This funding provides scholarships for 9 different programs. And as of January 2025, there are 18 scholarships recipients, and more are expected to receive scholarships every semester for the next year and a half. And that will have a long-standing impact on the workforce in Nevada for public health work. Any questions regarding this budget?
I have a few questions. I also am pleased to see that funding, $15 million, still remains in there. I think it shows the good work that we made on Senate Bill 118. Can you maybe provide a more detailed overview on what was accomplished by these local health districts, and see if we could phone a friend? Look at this.
Thank you very much, Chair Nguyen. We have Mitch DeValier, who heads up this effort for us and is our expert on just that topic.
And just to kind of follow up with that, what was accomplished with those funds throughout the last biennium, including into now, and what the continuation of those funds means for what we might be able to accomplish to bring us from the bottom of public health into, maybe the top 40?
Thank you for the question. My name is Mitch DeValier. That's M-I-T-C-H, and then the last name is D-E, capital V-A-L-L-I-E-R-E. I'm the agency manager for DPBH and run the Public Health Improvement and Infrastructure section, and SB 118 is one of our projects. To date, several counties have been able to utilize their funding for some pretty terrific projects. One example would be White Pine County. They utilized the funding that they have to purchase a pickup truck, which seems like, well, what was that for? But that's for them to be able to access different parts of the county for their services. The larger counties and the health districts, Southern Nevada Health District, Northern Nevada Public Health, and Central Nevada Health District, have all been able to utilize SB 118 funding for their many different projects. Some of the smaller counties were able to use their funding for social media to access the senior population, to let them know the types of care that are available in their county. For the future, there's a certain amount of funding that's obviously obligated to Central Nevada Health District, Southern Nevada Health District, and Northern Nevada Public Health. And those amounts will remain the same. The other counties, we're trying to look at some way that we can pool some of the funding together to allow for greater access to care in the counties that have smaller amounts. Esmeralda County, for example, was allocated about $4,000. It's very difficult for a program to be able to do anything with that. However, we were able to have a subaward with Nye County and the Nye Community Coalition to integrate those two together so that they could have better access to care. The funding going forward, I think, would be, it would set a great example of how Nevada is now wanting to prioritize public health in the state. So we're just very thankful that that was allowed with SB 118 and that it's in the continuing budget. And you had some other questions, I'm sorry.
I guess kind of following up on that, you kind of had mentioned that maybe you were, Senate Bill 118, I think part of the reason that a lot of people appreciated that because it wasn't a categorical approach. It didn't give the agency discretion on how they were going to spend that money. And it was on a per capita basis. So what public health districts in Clark County thought were appropriate were utilized there, and in our rural communities, they maybe were able to focus on something different. Do you anticipate that the funding and appropriation proportions that were outlined in 118 would continue with this funding moving forward?
This is Mitch DeValier for the record. Yes, especially with the health districts, those amounts will continue exactly as they were indicated. The remainder was allocated to DPBH to then give out to the other counties. We're hoping to be able to leverage that within DPBH to make sure that there is a more usable amount for the county, so that if we can consolidate some of the efforts in those areas.
Julia Peek for the record, JuliaPeek, and I serve as one of the deputy administrators and had the pleasure of working on this last session. So again, thank you for that. I just want to emphasize here, this is non-categorical on purpose, thank you, so that we have the opportunity to allow this to meet some foundational public health services that would not have another source of funding in the applicable jurisdiction. And I just want to acknowledge right now that Nevada Association of County Officials, Amy's in the audience, but she's done a phenomenal job going out to the frontier counties and figuring out what their public health service needs look like. And then we're trying to figure out how we can weave in a service there. In some cases, it's expanding on a service we already offer, better promoting it, or building a service. Your question related to, are we going to keep the proportions the same? Yes, for the health districts. Within SB 118, it said that DPBH would have the portion because we're the health authority in the frontier counties. We decided this last session to allow the counties to start looking at public health infrastructure, and that's a reason we allowed each frontier county to have a per capita allocation. But as Mitch had noted, I think we want to look more thoughtfully about foundational public health services, because one of our goals is to make sure that regardless of your geography, that you're offered the foundational public health services. So that might look different for the frontier counties, but it's a conversation. If they have a really good project that would meet a specific need, there's no issues in giving the county the funds again and working with them. We just need to better assess how SB 118 worked and did not, how we can improve that with the amount of funding we have. And then we're just being super mindful of federal funding, private funding, et cetera, and if there's losses in those programs, how we can use the SB 118 or again this foundational general fund to fill those gaps so that services aren't lost.
I just wanted to clarify, because the way the governor's recommended budget right now, it places that $15 million for allocations to support the public health infrastructure and improvements program into a single expenditure category. And so it sounds like you would not be opposed if we were able to structure this budget so the allocations went into these individual, separate expenditure categories to ensure that those allocations maintain the same intent that was in Senate Bill 118 moving forward.
Julia Peek, for the record, no issue in further delineating how those funds go to either locality or health district, however that looks. It's all in a special use category, as you noted, that single line item, none going, for example, to state personnel or operating or anything. It's all going to be in a special use contractual category. We can further delineate that if it's helpful. I also want to note, both for this question and some of the prior questions, for public health accreditation, we have to develop a really robust and transparent performance management system. And so we're doing that through dashboarding as well. But if it's related to the medical epidemiologist for opioids, for example, they will have deliverables. We have to update on those deliverables and we have to share it in some sort of transparent way. So too, the SB 118 funds in this continuation of general fund will need to be tracked with deliverables. So if one of the health districts said they were gonna do a project on oral health or infectious disease, we're gonna wanna be transparent about the successes or the pivoting if it turns out that project is not working as we thought. So happy to provide that in further detail, both on performance and if there's a way that we could track it better as far as the expenses, happy to do that.
That's really good to hear. I also know that in Senate Bill 118, there were some accountability measures where the health districts had to report back. Under this new, without Senate Bill 118, there isn't that reporting and accountability requirements associated with it. So you would probably, no one would be they're already doing the work. So if we were to add in that accountability measure and that reporting, no, you don't anticipate that there would be any issues with that.
Julia Peak, we would be happy to. There's actually several in the audience who attended just so they could speak to the good work they're doing. And then also I just want to acknowledge they did provide some letters for this because they wanted to highlight the good work they're doing, but none of us have an issue sharing the work that we're doing.
Perfect. Thank you. And I appreciate everyone's patience on the committee with some of these questions. Sometimes we pass legislation. It is working well, as in Senate Bill 118 from the last legislative session. So I want to make sure that if we're continuing these programs that the same legislative intent is followed. So thank you for that. Do we have any other questions from the committee on this? Seeing none, thank you so much. And that brings us, we'll close that budget and we'll move on to our next one, which is family planning, budget 3155.
Cody Finney for the record, thank you. I can't get it. We should all get the same coffee that Julia gets because that's.
She does bring great energy to a Wednesday morning meeting.
I love that. All right, sorry. All right, family planning, budget 3155. This is the slide 21 shows the overview of the family account for family planning. We do not have an enhancement request in this budget account. So slide 22 provides some of the details about some of the things, the numbers of people that have been served. This program allows us to take this money, grant it to local organizations or local entities and nonprofits. And through the account for family planning that was created in 2019 by this body, we are able to fund birth control information and supplies, including long-acting reversible contraception, educational information about family planning, referrals for medical services related to family planning, preconception services and preconception counseling when folks want to have children, and testing for sexually transmitted infections and any vaccines that are recommended. So we're just incredibly grateful for the continued support for this this effort in making sure that families are what they desire to be and stay healthy. Any questions on the account for family planning?
I have a question. I know that a lot of these are, I guess, smaller grants that are administered. Like, are they typically in the like $150,000 to $250,000 range?
Vicki Ives for the record. Thank you. They do range in that beyond for some of the, say for Community Health Alliance, their account for family planning award in this state fiscal year is $358,867. Some are as small as $27,540, depending on the scope. So the individual partner may choose to focus, and again, these are services for those who would not otherwise be able to afford them. They may choose to focus just on the contraceptive portions and not include in their scope of work the vaccine component. So it varies a little bit by partner of which allowable elements that they're implementing in each subgrant. I believe the largest award this state fiscal year is to Southern Nevada Health District at $400,500. But most, they bounce around in that $100,000 to $300,000 range.
I know in talking with some of our higher education partners that they have been able to utilize some of these programs for their family planning and medical services at both universities. So thank you. I don't have any other further questions. Does anyone have any further questions regarding this? Seeing none, thank you so much. And we will close this budget and move on to our very last one of the morning, 3213 immunization program.
Cody Finney for the record. The immunization program overview is on slide 23. This represents another one of our foundational public health services and our efforts to continue the access to vaccines and prevent transmissible infections in our communities. On slide 24, we have the enhancement request. This is M201. This is the only caseload budget we have in our public health budgets. So this caseload is about the amount of money we will need to purchase the vaccines based on what we're seeing for Nevada Checkup. And the reason for the necessary increase is those changes that you've heard about from Medicaid in the federal medical assistance. E250 is moving a position, a health resource analyst. This is to a state position. This is funded completely with the state immunization grant. Questions about this budget?
Assemblymember Mosca.
Thank you, Chair, and thank you for this. My question is really around, we know that over 1,000 people were cut at the CDC recently, and so just want to know what's the update that we're hearing here in the state and how that could possibly impact this. Thank you.
Thank you, Assemblymember Mosca. I want to acknowledge this morning that it's been challenging over the last few days to get solid information about what's happening. So we're definitely getting reports of cuts at the CDC. We do not, as I sit here today, have knowledge of this being impacted, or I wouldn't have asked to do it. But we're monitoring that on a daily basis. As I read the news websites this morning, even the news website I was reading said the original post of this story indicated that people had received letters of their layoffs, but it is now unclear who is being laid off. And that is true for the CDC staff that are assigned to us and throughout the state with other organizations. And so we're just monitoring that as closely as we can. And if we're nothing else at DPBH, we are agile and we will respond to those changes. I told the staff I was going to buy them all T-shirts that said "Don't panic," because panic is the enemy, and we're going to make smart decisions and work as carefully as we can to mitigate any negative impacts to Nevadans, because people should have access to vaccines.
Thank you for that, and I know we want to make sure we're protecting our Nevadans here, and I know you're going to do this, but if you can make sure we are updating our fiscal staff as soon as we know as well. Thank you.
Senator Titus.
Thank you, Madam Chair, and thank you for that response. I do appreciate the everybody remain calm until the dust settles and really see the impacts. There's a lot of unknowns out there. But what we do know is that you had contracted with a vaccine folks that then failed to come through with that. So do we have a new vendor that can actually make sure that Nevadans get the vaccines that we've authorized?
Thank you. Cody Finney for the record. We do not yet have a new vendor for that statewide coalition. We are in the process of doing that that recruitment. We are working with partners that the coalition had worked with. We're working with many of them directly to make sure that vaccines remain available regardless of geography or ability to pay or any of those issues. We're continuing to work with those partners. I'm going to stop there.
Julia Peak, no, I think you did a great job, but I will add, since you gave me the mic, I just want to acknowledge, Chair, if you're okay with that. After the coalition funding stopped, I just want to acknowledge all the partners that came forward and had coalition-like meetings to figure out what this looks like going forward. And so, as Administrator Finney mentioned, there will be an RFP going out where we hope to have one convener, but the partners are all very excited to continue to work together and whatever that looks like. And I'll just know that sometimes the best messenger of the information is local. So if we do have a coalition that's the convener, still these local partners that came to the table are the best messengers for that information locally.
Thank you for that. I do appreciate it. Again, I agree, local is the best. How much money did we spend on that program and did we lose?
Julia Peak for the record. So I'll have Ms. Ives, I don't know if she has it. How much did we spend on the immunization coalition over the course of history, or?
With the program that then failed to actually produce.
Okay, so Julia Peak for the record. So I'll just note there wasn't anything that necessarily failed to produce. The vendors in which the coalition was working did excellent work. The issue at hand with the coalition is ensuring that there was fiduciary accountability related to the oversight of the vendors and the use of the funds that we gave them. We're very strict, obviously, in how that funding can be used, and when we would audit those expenditures, we could see vendor work was done, but payment was unclear. And so that's why we're trying to recover those funds, but I don't want to negate the great work done by those vendors, which did occur.
Do we know how much that was?
Cody Finney, for the record, it was about $200,000 that we're trying to recover from that that coalition, and we're working with the Attorney General's office to see what avenues we have towards that. I'm told $292,000.
Okay, thank you. And then my next question, if I might, Madam Chair. So thank you very much for all that you do. The Nevada WebIZ funding for that is solid, and there's not going to, because I find that very valuable, looking at not only on a personal level when I go for my vaccinations, what do I need, but I think it's really important that people stay current and that it's accessible. No issue. That's a state-funded thing, not affected by any federal programs or perhaps budget restrictions.
Julia Peak, for the record, that is highly reliant on federal funds.
So.
There is a great focus federally on data modernization, one of which is looking at the WebIZ system. So we're hopeful that this would not be subject to any cuts. There are new projects being funded recently related to data modernization, and immunization is one of the projects that we picked. We've not been told that that could be compromised. However, much of the funding we have, as is shown on the table earlier, is federal. So if there is an issue, we hopefully will have the general fund of the $15 million that we could make choices and gap fill quickly, but we are very dependent on those funds remaining.
Thank you for that, and please, obviously, we would like to keep abreast of what that process is. As I said, the dust settles, so thank you very much. Thank you, Madam Chair.
Speaker Yeager.
Thank you, Chair. I don't have a question, but really just a comment. I want to applaud you because I think, many in this room have been doing this work for a long time, and you are used to changes in the federal administration, but I'm going to venture a guess that this is unprecedented waters that we're in right now, and so kudos to you for trying to navigate this. I do agree with Senator Titus that the dust is going to settle. What keeps me up at night is how that dust is going to settle. And I think what we've heard today and yesterday and in all these budget hearings is that the dust could settle in a way that's extremely damaging to Nevadans and extremely damaging to our state budget. So if you can keep us in the loop, I know every day it seems like we hear something different. But we've got to get this figured out, and hopefully at some point our federal government will realize that the federal government is nothing more than a collection of these 50 United States, and they'll figure out what they're going to do, and we can figure out how to move forward. But, until then, just please express your appreciation, my appreciation to your team for trying to navigate this, because I'm sure you're having a lot of sleepless nights as well, as are all of us. So. Thank you for the time and letting me say that, Madam Chair, and thank you to the folks who are here today trying to get this work done.
Thank you. Any further questions regarding this budget? Seeing none, we'll go ahead and close that. Again, thank you guys for your efficient and informative presentations this morning. And that leads us to, that's our last budget for the morning. So we will go ahead and move to our last agenda item, which is public comment. I'd ask anyone that has any comments to make in public comment, come up to the table and please state your name and please limit your comments to 2 minutes, and we will begin when you're ready.
Julia Peak, for the record, Division of Public and Behavioral Health. I wanted the opportunity to answer Senator John Darrow Loop's question. Apologize, I wasn't at the table prior. We do have that multiple sclerosis website up. It can just be hard to navigate to, so if you just, in your search bar, DPBH, MS, it'll pull you right to the program. If you have any suggestions, happy to. And we do the proclamation every year. It should be out soon.
I appreciate that, and I will work on it. Thank you. And thank you for all you do.
Don't be shy.
Good morning. My name is Nikki Aker. It's Nicki, last name Aaker. I'm the director of Carson City Health and Human Services, and we are one of the local health authorities. We're not a district, but we do provide services in Carson City and other counties by state delegation or contract. And I just want to thank you for allowing me to say a few words about our public health funding, SB 118, and how Carson City is using those funds. First, I would like to thank everybody that worked on getting this funding for us. It's greatly appreciated. This funding's been instrumental in working on gaps identified within our communities that are not addressed with funding that we receive. Carson City Health and Human Services, or CCHHS, is an agency that's highly grant funded to provide public health and social service programs. And as everyone knows here, those grants have specific deliverables that may not allow us to address identified needs within our community. But this funding allows us to work on some of those gaps. For this funding, we used our 2024 Community Health Needs Assessment to determine how to use those funds. And our assessment identified 4 priority areas: access to basic needs, access to healthcare for specific populations, mental and emotional health, and substance use prevention, treatment, and recovery. Under the access to basic needs and mental and emotional health, social isolation was an area identified for children and seniors. We partnered with Carson City Parks and Rec to extend a ski program for children to learn to ski, which increased their level of physical activity, provided an opportunity for these youth at a reduced cost that may not be available to them otherwise, and got them connected with other youth, which reduced that social isolation. A program for seniors is being discussed with local partners with the same goal that would be attractive to the seniors in the area. And under the access to health care for specific populations, transportation continues to rise to the top as a barrier to services. CCHHS is partnering with another local partner to increase the opportunities for transportation to medical care for our seniors. Another initiative that we're working on is to develop a sexually transmitted infection, or STI, testing campaign for our youth, older adults, and yes, we are seeing a rise in sexually transmitted infections among our older adults, and the LGBTQI plus community, informing them of what services are available within our community. And then under the substance use prevention, treatment, and recovery, some of you may remember that agencies receiving funding for youth vaping prevention in the past. CCHHS was one of those agencies that the funding was not renewed. But with this funding, we're able to start that program again. We have the basis, so we can start it in the schools again, along with our tobacco prevention efforts. And we've heard a lot about the opioid funding this morning, and by leveraging that grant that the city received, this education will also include opioid misuse and the dangers within that same presentation, so that we're in the schools once and we're addressing vaping, addressing tobacco use, and opioid use. So I want to thank you for your time today, and I'm happy to answer any questions if you have any.
Thank you.
Madam Chair, members of the committee, for the record, Darren Winkleman, Administrator for the Central Nevada Health District. We are here in support of the Division of Public and Behavioral Health budget and the continuation of the public health improvement funding. As a small health district, the funding is critical for us to continue our public health functions and the core functions that we do within the district. We'd like to thank the DPPH leadership for working hard to ensure these funds are available to us to help meet the needs of the visitors and citizens of our state. We are using some of that SB 118 funding for our data infrastructure, data improvement, data modernization projects that we have going on in the county. We are working with Churchill County to begin the process of entering a new building, and so this funding will be critical for us to get all that new data cabling, data infrastructure into that new facility. So we appreciate the funding and everything you've done for us as a local health district. Thank you.
Good morning. Hello. My name is Amy Hines Sutherland, AMYHYNE-SUTHERLAND. I am the Health and Human Services Manager for the Nevada Association of Counties, or NACO. NACO serves as the statewide association that represents all 17 of Nevada's counties. First, I'd like to thank this body for the passage of SB 118 Public Health Improvement Funding during the 82nd session of the Nevada Legislature. This non-categorical, flexible funding was critical then, as it is now, to address gaps in our public health system and build the public health infrastructure that will ensure a healthy, safe, and resilient Nevada. We want to thank the governor and DPBH leadership for recommending the continuation of these public health improvement funds, and we urge this committee to support that proposed budget item. The local public health priorities identified by local governments and supported through these flexible funds are as varied as they are critical to the health of their respective communities. They include efforts such as access to restorative dental care for youth in partnership with the Silver State SEAL program, HIV prevention and treatment, community CPR training and placement of life-saving automated external defibrillators, or AEDs, in public spaces, repairing infrastructure and improving delivery of public health services at rural senior centers, and improvement to local environmental public health coordination and planning, just to name a few of the uses for SB 118 funding across the state. Investment in Nevada's public health infrastructure not only gives all Nevadans a chance to live their healthiest, fullest lives, but it also impacts our state's ability to welcome new industries, ensure public safety, and produce a healthy and productive workforce. Given this, the Nevada Association of Counties supports the continuation of public health improvement funding and looks forward to continued collaboration between DPBH and local governments to identify the public health priorities most critical to local communities. Thank you.
Good morning, Chair and members of the committee. My name is Taylor Allison, Taylorallison. I'm the Emergency Management Government Affairs Director for Lyon County. We wanted to thank the legislature for the passage of Senate Bill 118 in the 82nd session and for considering continued funding through the biennium. Lyon County utilized this one-time appropriation of per capita public health infrastructure funding to launch the Live Better Lyon campaign, a strategic initiative aimed at increasing community awareness of existing public health resources, with the thought in mind that the program could be scaled as funding was available to address priority public health needs. This campaign has allowed us to provide targeted education and outreach on foundational public health issues identified in our local community health needs assessments, including traffic safety, mental health, senior services, sexually transmitted infections, and other key public health concerns with measurable outcomes. The success of Live Better Lyon underscores the necessity of sustained funding. Public health challenges do not dissipate after a single budget cycle, and continued investment is essential for long-term community health improvement. By maintaining this funding, the legislature will empower communities like Lyon to build upon existing efforts and overall improve the well-being of all Nevadans. Thank you very much.
Good morning, Madam Chair and members of the committee. My name is Sarah Adler with Silver State Government Relations, and this morning I am proud to represent the Nevada section of the American College of Obstetricians and Gynecologists, or ACOG, and they strongly support E261, the Perinatal Quality Collaborative that you heard this morning. I would also call them the Vicki Ives fan club. They really support the work that she does. Nevada is one of few states that do not have a Perinatal Quality Collaborative, and ACOG so hopes that Nevada moves in that direction. Their other statement this morning is to thank this body's investment in BA 3155, the Account for Family Planning. A planned pregnancy leads to prenatal care, leads to healthy babies, and leads to families with planned children and less stress. As you've heard, Nevada is way too high on the syphilis infection list, and this leads to congenital syphilis being passed to babies, and enormously sadly, many babies are stillborn or die shortly after birth when they suffer from congenital syphilis. So this account is preventive work. So ACOG thanks you.
Good morning, Chairwoman and members of the committee. Allison Herzik, ALLISONHERZIK. I'm the Director of Nevada Government Relations for Dignity Health St. Rose Dominican, and here today to provide public comment in support of the $15 million in the governor's recommended budget for the public health improvement and infrastructure program. We supported SB 118 last session, which created and prescribed this funding before you today, and we're thrilled to see this in the governor's recommended budget this time. We want to stress the continued importance of this funding, which will significantly help our state's public health infrastructure and workforce. And we want to thank the Division of Public and Behavioral Health for their continued work on this effort and appreciate your time this morning.
Good morning, Madam Chair. For the committee, Bradley Mayer, partner with Argento Partners, commenting today on behalf of the Southern Nevada Health District. You know, the idea for SB 118 came about because, you know, we are very reliant upon these categorical funding, a lot of federal funding that comes in, and we're sort of having money come in, building infrastructure up, and then having to tear it down when it goes away. And we're seeing now that, of course, COVID era funding is ending in that regard. And so this has been a critical flexible dollars for us to go ahead and address some of these needs. You know, when the funding, the health aid to counties was cut in 1991 by the state, and it was kind of promised to return, and it was take 30 years, of course, for this body to then finally thank you for passing this, and thank you to the governor for including this in his budget. Of course, this is critical for us to build and maintain public health infrastructure to support the growing population. These monies, are allowing us to sort of make decisions at the local level, and each health authority and entity that gets it to address their very specific needs, which of course are different across the state. And so SNHD has utilized these funds and plans to use additional funds to improve access to care, enhance disease surveillance and control, address behavioral health challenges like the opioid epidemic and the youth vaping prevention funding that was mentioned before, also focusing on health disparities. Again, I said the events of the last several years have really shown what the impact that public health has on all our lives, and the need to ensure that we have the ability to respond to emerging and existing threats as they come. And so we thank you for that. And one other thing, if I could put my other hat on, I just want to mention is regards to the health district's also a partner in the Nurse Family Partnership Program, of which you heard a little bit about today. And so that in that role, specially trained nurses are visiting first-time moms, nearly half of who are on Medicaid, developing preventative health practices during pregnancy. Over 90% of those participants have a baby born at full term. Visits continue for the first couple years of the child's life to ensure they get off to a healthy start. And I think most importantly, each dollar invested in a program saves $4.30 in future costs for the highest risk families. And so that really benefits mothers, babies in our community. So I just wanted to mention that as well. Thank you so much.
Good morning, Chair Wynn and committee. For the record, my name is Joelle Gutman-Dodson, Government Affairs Liaison for the Northern Nevada Public Health, formerly known as the Washoe County Health District. I'm here today in support of Budget Item 3234, so fondly referred to as SB 118 from last session. We thank the legislature from last session for passing that bill. It was no easy task. And we thank the governor for including it in his executive budget this session. This historical funding has been instrumental in strengthening local health authorities by allowing local decision-making. SB 118 ensured our ability to divert money to our most pressing public health issues and fill some gaps that we needed. And as I just wanted to end, as stated earlier, there have been a lot of sleepless nights in public health. And there's an incredible amount of uncertainty happening nationwide, but Nevada is so incredibly reliant on federal funding. I think it's particularly in public health. It's about 52% of Northern Nevada public health. No matter how long I do this, I get nervous. Sorry. It's about 52% of our budget. So that's 102 staff at Washoe County. So, we're on local funds and other things like that, but it's a scary time. There's also a lot of things happening in public health that is scary. So I just want to emphasize the importance of state dollars invested in our Nevada communities. And so it's more important than ever, and we didn't see this coming 2 years ago, but state Nevada dollars invested in Nevada public health is really important. So thank you.
Oh, final call for public comment here in Carson City. I don't see anyone in Las Vegas. ABH, if we can go to the phone lines, is there anyone that has called in public comment?
Thank you, Chair. The public lines are open and working. However, there are no callers to provide public comment at this time.
Well, thank you. And that brings us to the end of our meeting. Thank you guys, and thank you for your patience and your thoughtful questions, and meeting adjourned.